So first of all, when we are talking about this topic, let me discuss very briefly trauma and its manifestation in African Americans. And so there's many epidemiological studies that have been published. There's a lot of prevalence studies out there that show that African Americans have the highest rates of trauma in the United States. For instance, the US Department of Justice has published statistics that show that urban Blacks are much more likely than whites or Hispanics to be victims of a violent crime. There are national studies, such as the Collaborative Psychiatric Epidemiological Survey, that show that Blacks more frequently meet criteria for post-traumatic stress disorder than any other racial group. In addition, homicides are more likely to occur against Blacks than whites in highly populated areas, according to the US Department of Justice. In addition, there's an additional challenge when working with the African American community, and that challenge has to do with their use of mental health treatment. It's well documented that African Americans underutilize mental health treatment. And this is for a number of reasons that I'm not going to spend a lot of time here detailing. However, stigma is a big problem when it comes to utilization, and in many cases, rightfully so. So evidence-based practices, they definitely work. They have been proven through randomized controlled trials and meta-analyses to work. However, EBPs can only work for those who, number one, have access to the treatment, number two, choose to trust the process, and number three, are motivated to participate. And so it's well documented that African Americans experience mental health disparity and that they have less access to quality evidence-based mental health services in their communities. When discussing ACT, there are very few ACT interventions that are available to African American clients in African American communities. In fact, there's only about 5% of the behavioral health workforce is considered to be African American in the United States. And there are even fewer ACT clinicians that are African American. Very few African American clinicians that are trained in acceptance and commitment therapy. Thus, access is a real problem. Secondly, even if an evidence-based practice is available, it can only work if the client chooses to trust the process. So Dr. Arthur Whaley, he's done a lot of research to talk about this area. He's coined the term cultural distrust to describe the views that many African Americans have about mental health treatment. Due to the Tuskegee experiments and due to the fact that the history of psychology in America is fraught with negativity towards African Americans, many do not trust the quote unquote system of clinical treatment, and many suffer silently and chronically with emotional problems. Third, there's, an EBP is great, but it can only work if the client is motivated to participate in that particular EBP. Thus, there are limitations produced by generalizing EBPs to Blacks suffering from trauma. So ACT as an intervention for African Americans, it does have some benefits that may be appealing to the African American population. One thing is ACT is evidence-based, and it does show potential in treating trauma for Blacks because, for one, it's a non-pathologizing approach. So other approaches, such as cognitive behavioral therapy, for example, they have the goal of reduction of symptoms. For instance, the goal of CBT is to reduce negative thoughts. Often a client needs to have a diagnosis, however, such as like a diagnosis of depression or anxiety, in order to begin work reducing those behaviors, reducing those thoughts that are associated with the diagnosis. But ACT, acceptance and commitment therapy, is different in that the client doesn't need a diagnosis to begin to work. Instead, ACT promotes the understanding that suffering is part of the human condition. It's not a dysfunctional, diagnosable condition. And so ACT normalizes suffering, it normalizes pain, and it normalizes avoidance as normal human responses. At the same time, ACT helps individuals move towards more value-driven living. Based upon the prior research, the normalization and destigmatization of the human experience has been noted as appealing to the African American community. So let's talk a bit about the ubiquity of human suffering and the science of suffering. So when talking about the science of suffering and the epistemology of pain, there's some assumptions about acceptance and commitment therapy in regards to suffering. So ACT, says that pain, even though it doesn't feel good, is of value to human survival. Pain is a natural part of aging, for example. ACT teaches, however, that experiencing pain does not need to interfere significantly or permanently with your quality of life or with the meaning of life that you have. And so when we think about freedom, freedom in ACT looks like a person who has learned to experience and work with pain on a moment-to-moment basis. It looks like a person who's becoming able to approach pain and suffering with an attitude of curiosity and interest rather than being overwhelmed. Freedom would look like the ability to accept feeling frustration or sadness instead of actively running from those feelings. And freedom would look like, in the client, the development of more self-compassion and more compassion for others. So science says that universally we all experience certain factors that influence our suffering. These are factors that, again, universally we all experience: genetics, lifestyle, life stress, social factors, beliefs about pain, gender, depression, anxiety, long-term health problems, fear of pain, and past pain experiences. All of these universally affect us or influence how we experience suffering as human beings. But then when you take a look at the social determinants of health, there are additional factors that influence the experiences of African Americans in the United States. Now, the social determinants of health model, it's been adopted by the World Health Organization. Many other major organizations have adopted it. But when you look at this model, we can see that there are additional factors besides the universal factors that I just mentioned that are important to address in treatment. So in addition to the universal factors, African Americans also have additional factors that can influence their experience of suffering and pain. In addition to what I already discussed, that was universal, additional influences might be their levels of access to care, illness chronicity, life stress, cultural competence, cultural spiritual beliefs, racism or discrimination, socioeconomic status, police and prosecutor bias, stigma and cultural distrust, and past pain experiences. So as we can see, the African American experience, has these additional factors that would need to be addressed in therapy. So ACT can be defined, and this is a simple definition by Stephen Hayes and Strozal in 2004. But ACT is a therapy approach that uses acceptance and mindfulness processes to produce greater psychological flexibility. And when we look at psychological flexibility and define that, what that is the ability to be in the present moment with full awareness and openness to experience and to take action guided by values. This is the main thrust of ACT, is that we want to take a look at psychological flexibility and we want to increase it. So this is the Inflex-a-Hex that is a major part of the ACT model. And again, the whole goal of this model is to take a look at each of these pieces of where a person is stuck. Where's a person having problems in regards to their emotions? Where's a person running away from their emotions? The goal is to look at the psychological inflexibility of the person. I propose, and I'm not going to go into detail about this here, but again, this is just, kind of wetting your whistle about these things. But I propose that these same issues of psychological inflexibility can be examined, but being examined in a culturally congruent framework for African Americans. In the same way, the 6 core processes that we look at when we are working with the client in regards to ACT, the whole goal of looking and working with these 6 processes is to increase a person's psychological flexibility. And we can also do this work and engage in this work, again, with the same 6 processes. However, we can culturally tailor these processes in order to be more appealing for the African American population. And not just appealing, but also to address some additional issues that need to be addressed in therapy. So when you look at the techniques of ACT, there are a number of techniques that are used. I mean, I'm not going to go into detail about them here, but metaphors are used, paradoxes, experiential exercises, mindfulness training, audio snippets, videos, role plays, checklists. A number of things are used in terms of techniques. What I propose is that to culturally tailor acceptance and commitment therapy, there are additional factors that need to be included in that model. And so, for instance, the Black church has been of great historical significance in African American experience. And not only that, but it has been a protective factor for a number of people. So pieces of that may be integrated into a culturally tailored ACT model. I'm not going to go through this whole list, but again, these are some of the ways in which ACT can be culturally tailored. In addition, the exercises that are used in ACT, they can become, in terms of experiential exercises, they can become more relevant. There could be the use of culturally relevant metaphors. The role plays can be more reality-based. There can be an inclusion of racism and discrimination, ways to address it. There can be an inclusion of addressing barriers to treatment, addressing stigma, addressing cultural views about mental health treatment. And so these are all ideas that I've been working on for the past, actually 2 years, in regards to culturally tailoring ACT for the African American community. However, I wanted to be able to open this up as far as this discussion, because I would love to have more experts, whether they're trauma experts, African American leaders, a number of individuals that can speak into this process of culturally tailoring acceptance and commitment therapy for our own African American community. So thank you for taking the time to listen to this. And if you want to contact me, if you are interested in this work, if you're interested in inputting your opinions and your views about it, then please feel free to contact me. I would love to hear from you. Thank you so much.